This isn't about putting government in charge of your health insurance. It's about putting you in charge of your health insurance. Under the reforms we seek, if you like your doctor, you can keep your doctor.
Another now famous promise from President Obama in the run-up to the passage of the Affordable Care Act. But as many Americans are about to find out, keeping your doctor may not be as easy as he made it sound. Dr. Scott Gottlieb is a practicing physician and former deputy commissioner of the Food and Drug Administration. He's also a resident fellow at the American Enterprise Institute. So welcome back.
Thanks for having me.
So we're now hearing these reports about people not being able to get their doctor, keep their doctor, even if they keep their insurance or get new insurance. Why is this happening?
Right, because the networks that these Obamacare plans are using are extremely restrictive, narrow networks, meaning they're not contracting with a lot of doctors, and they're doing that to try to hold down costs.
How does it hold down costs?
First of all, it impedes access. You might just not be able to get an appointment. Second of all,
waiting lines?
Right, and the plans are also going out and trying to contract with the lowest cost providers, which typically are Medicaid providers. That's why many of the plans in the exchanges are actually Medicaid HMOs.
They're called Medicaid Plus in the industry, which is the kind of the lowest level of care, and that means they're low reimbursements by the federal government.
Right, they're not. The plans are not paying the doctors a lot, and in fact, they're actually going back and renegotiating the contracts now and cutting what they're paying the doctors. Now,
we are also hearing anecdotes that this is happening in the Medicare program, the Medicare Advantage program, which is a private form of Medicare care. Is that happening there too?
Right. So remember, there were $158 billion worth of cuts to the Medicare program. The administration papered over those cuts with some money that they gave the plans ahead of the election. Right. It was part of the Affordable Care Act to pay for the Affordable Care Act. Now those cuts are coming due, and what the plans are doing is instead of raising premiums, they're cutting access to doctors. They're basically skinning down their networks as well. This does save money.
Well, give us a sense of the magnitude here. I mean, you're talking about thousands, you're talking tens of thousands. Are you really talking about millions of people who are going to have their access to physicians restricted?
Well, anyone who goes into Obamacare is going to have their access restricted.
So
there's
that's
no question about it. It's millions. You might be able to keep your GP if you're lucky, but you're not going to be able to keep your full complement of doctors because these networks are too small. I found one practice in Florida that only has 7 pediatricians for accounting the services 260,000 kids. 7 pediatricians, not 7 practices, 7 doctors.
Seven doctors.
I found a plan in New York that only has a single oncology practice in it.
Wow.
And if you go outside your network, you're forced to pay the full bill. It doesn't count against your out-of-pocket maximums or your deductible in most cases.
Is it always the full bill, or is it sometimes it's just the reimbursements are less?
Right. Sometimes it's partial payment, and sometimes it's 100%.
So what does this do? Let's say I get really sick and I have cancer, and I want to see a specialist outside of my network, maybe somewhere else in the country. I mean, a lot of people I know, you know, will get cancer, and they might say, you know, I want to see a specialist at MD Anderson in Houston, or I want to go to the Mayo Clinic if I live in the upper Midwest. Is that kind of access going to be restricted here?
Well, that's exactly what's going to be restricted. It really puts at a disadvantage people who have rare conditions who want to go to a specialty institution or even get a second opinion. You're not going to be able to do that. You know, the Memorial Sloan Ketterings, Hutch in Seattle, those aren't going to be accessible.
Those are great institutions with great doctors, with great care, and people from all over the world go to those hospitals. Are you saying that if I want to go to one of those and it's not in my network, I'm going to have to pay substantially out of my pocket for my cancer care? Is that really what's happening?
Substantially, and since it's expensive in the first place, it'll be prohibitively costly for people. They just won't be able to do it.
Wow. Now, there's another thing that's happening as part of the result of this law, and that is the integration of medical networks, hospitals, and physicians.
Right.
Tell us what's happening there. You described it as the death of Dr. Marcus Welby, MD, the so-called the family physician, and the 3 or 4 doctor practice. Why has that happened?
Right. Well, doctors are becoming, you know, owned entities of hospitals and large health systems, and this is for a couple of reasons. It makes it easier to regulate.
The death of Dr. Marcus Welby, MD, the so-called the family physician, and the 3 or 4 doctor practice. Why has that happened?
Right. Well, doctors are becoming, you know, owned entities of hospitals and large health systems, and this is for a couple of reasons. It makes it easier to regulate the physicians if they're part of systems where you can regulate the system rather than regulating down to the level of the doctor. So that's primarily why they're doing it. Also because they want to transfer risk to physicians. They want physicians to be bearing the risk for the cost of the care they're delivering.
But what is the incentive for doctors to sign up with these big networks?
Well, there really is no incentive other than the fact that their overhead costs are going up and their reimbursements going down, and so their real income's declining. So by signing up with these big networks, they effectively become salaried, and they at least know what they're going to earn next year.
And you've written that there's an awful lot of evidence to suggest that when doctors do sign up for these networks, their productivity goes down.
That's exactly right.
Why so?
Well, they do less. They become shift employees, so they become less entrepreneurial.
They work 9 to 5?
Exactly.
They're 9 to 5ers?
And where you lose productivity is in the handoff. So doctors effectively do shift work, and they don't take care of their own complement of patients in many cases. They just hand it off to the next physician. And you lose productivity in the form of that shift, that handoff, if you will.
Some of the architects of Obamacare would respond to what you're saying and say, look, the model we're pursuing is something called accountable care organizations. Right. And those have proven to be successful at Mayo and Geisinger and some of these other big institutions which know how to manage themselves very well. So what are you worried about? This is going to save money for everybody and still deliver quality care.
If you believe someone has to ration, the government could ration through boards, which they're doing in Obamacare. The patient can self-ration by being exposed to some of the cost of their decisions, or the doctor can ration care by being capitated effectively, having to bear responsibility for the cost of the care they're delivering. They're favoring the doctor being capitated, and the doctor
capitated means individual payments.
They get a lump sum payment for taking care of a whole population of payments, and if they do more for those patients, they're going to lose money. I think that's the least transparent place for the nexus of cost consideration to reside with the doctor, because as a patient you might not know wasn't offered to you. At least if the government does it, you see what the government is doing, and if you're forced to make those considerations, you know the choices you're making.
All right, Dr. Gottlieb, thanks so much for being here. All right, still ahead. If the Obamacare rollout isn't a big enough mess, now the HHS is seeking to undermine a federal court decision and control who can donate bone marrow. What